Um, Thank you. Thank you, Dr. Wong, for the kind introduction, and Dr. Au for your invitation for me to present the experience of SBLT in Hong Kong. And also thanks BCCA colleagues for your presentation, which are really inspiring. And we definitely learned a lot from your experience. So today's talk will have a quick snapshot within 15-20 minutes on the current SBLT experience and situation in Hong Kong. We will quickly go through the some of the recent publication of SBLTs of our Hong Kong experience in the literature, including the lung, the liver, prostate, and spine met. So we'll also quickly review our strength of development and also the bottleneck of SBLT development. And finally, I would like to have a few slides to introduce our SBLT study group initiatives. So SBLT in HA, that's the main provider of oncology service in Hong Kong. That's the public system. Actually, we have like 6 clinical oncology centers providing radiation therapy services. And in all 6 clinical oncology centers, we provided the SBLT for HCC and also liver met, as well as for primary lung cancer and lung metastasis. In some centers, we provide spinal metastasis, prostate cancer, and pancreatic cancers. So I think this is very much related to the availability of the specialists and also the resources allocation. So just like in BCCA or other cancer centers in the world, actually SBLT is a gradually growing business, and we are actually getting more and more referral for that. So, but disappointingly, we still don't have a territory-wide SBLT registry in Hong Kong. So based on the data of 2 university centers, that's the Queen Mary Hospital and Prince of Wales Hospital, there was a gradual increase in the SBLT cases in the past few years. So on average, I think in Hong Kong we have like around 250 and 300 SBLT treatment cases every year. So it was a gradually increasing service. So then we quickly go into different sites for our experience in SBLT. Firstly, we have a quick look at our lung cancer experience. So actually, one of the center, Twin Moon Hospital, started the SBLT service quite early, day back to 2000. So the initial 20 patients experience were reported in the Green Journal, which actually the center was able to achieve a good local control rate and a cancer-specific survival rate by 2 years. And the toxicity profile was favorable. So in coming years, and actually every almost all HA centers in Hong Kong, they subsequently reported their experience in SBLT lung, including the Prince of Wales, the Eastern Hospital, the Queen Mary Hospital, and Princess Margaret Hospital. So now SBLT for early lung cancer or lung metastasis is a routine service in all HA RT centers. So besides some retrospective series of reporting our experience, actually we are trying to look for some small scale or some prospective phase 2 studies to look for some interesting to answer some clinical questions. So I think one remarkable initiative is a joint center study to review the role of SBLT in patients with EGFR mutated patient with oligoprogression. So this is a special problem in this part of the world, as we got a high proportion of patients with metastatic lung cancer and have a EGFR mutation. So this small but remarkable study shows that actually adding in SBLT was in progressive disease of EGFR mutated C lung resulted in a improved progression-free survival and possibly an improvement in overall survival compared with a matched cohort. So we are also happy to report that actually in the recent World Lung Cancer Conference in Toronto, we have one oral abstract and one poster from Hong Kong. So these two studies were joint effort by, for example, the first oral abstract were joint effort by 7 centers in Hong Kong. So it is a signal detecting phase 2 study to assess the efficacy of preemptive local SBRT for so-called the oligo-residual disease of CA lung with EGFR mutation. So it shows a favorable trend that the patient have a better progression-free survival at first and second year. So another poster presentation was on on OC rearranged cancer. It's about the oligoprogression or oligometastasis, how adding in an SBRT can improve the outcome. So it shows a favorable improvement of progression-free survival from 12 months to 20 months. So again, this was a joint effort by 5 centers in Hong Kong. So for HCC, because we have a huge population of HCC patients, that's why we actually, Prince of Wales Hospital in Hong Kong had started their service back to year 2000. And although this was only a small scale study of 16 patients, it reported a reasonably good local control rate and 1 year overall survival of 60%. That report was dated back to almost 7 years ago in 2011. And Dr. Law of Eastern Hospital of Hong Kong also reported, gave the second report of HCC SBRT in Hong Kong. And again, with a gating system of with RPM and the local control and 1 year overall survival were all satisfactory with a reasonable toxicity rate. So further expanding our experience, Dr. Lee of Tuen Mun Hospital, actually we started a program with help and guidance of Professor Laura Dawson on HCC patient. And because in Hong Kong, actually we don't have a screening program for HCC, and that's why we actually encounter huge volume HCC in many of our centers. So in this important series, actually nearly half of the patient has a tumor volume of larger than 500 cc. And we treated with a relatively moderately hypofractionated regime of 4 grade per fraction to 5 to 10 grades. It was like a palliative dose, but the local control was satisfactory and the toxicity was also acceptable. This was presented in ASTRO 2012. And Queen Elizabeth Hospital also reported their series. In Hong Kong, we also have a relatively high proportion of patients with very bad cirrhosis due to hepatitis B. And we have proved that this SBRT was also possible in Hep B-associated stereotactic patient. And we also, because TACE was also very widely practiced in Hong Kong, we also look at the data whether we can combine SBRT with TACE. So this was reported in ASTRO 2016. So again, we have a huge, we have a high proportion of patients with huge tumor, and some of them with relatively poor liver function. And the local control was comparable to other locals, to other worldwide series, with median overall survival longer than 1.5 years. And the toxicity was again acceptable. We're happy that we also have some very enthusiastic medical physicists who actually try to publish on how we can incorporate the TACE with the SBRT. Importantly, because the TACE use a lot of lipido, which is densely radio opaque. So that's why, and we have some resources problem to put in fiducial marker for every HCC patient. So that's why we use the advantage of the radio opaque nature of the lipido and use this as for image guidance in HCC SBRT. And this has been published in full papers. So in view of this, we are happy that the Hong Kong oncologists were able to participate in the preparation of this consensus statement on how to incorporate SBRT for HCC in our Asia-Pacific setting. So we are also excited that the Hong Kong U team by Dr. Victor Lee will granted research grant to study SBRT versus TAC for HCC cancer, and also study the role of PET scan in assessment of the SBRT response. And there were two more combinational approaches were coming. Actually, we just confirmed that we have confirmed the funding for immunotherapy plus SBRT, and the details of the patient recruitment will be announced very soon. So hopefully, with combinational approach of SBRT plus immunotherapy can give better outcome among these HCC patients. So Dr. Poon of CUHK also started a SBRT program in Prince of Wales Hospital, and I think the preliminary data will be presented in ESMO Asia 2 weeks later. So according to some early data, actually the quality of life data and also the local control data were excellent. So for SBRT spine, we actually very much learned from the Toronto group experience. We have also started our SBRT spine program in Two Moon Hospital and also in some and two other hospitals in Hong Kong. So the local control, I think it's comparable to local report, around 90%. And we also have reported our oligo non-spine bone met series. Actually, the local control was also encouraging. And also the median disease-free survival was also encouraging. So in order to have a better use of SBRT, just like the head and neck MDT team, we also have a spinal bone met MDT in now in 3 of our HA centers. We in Two Moon Hospital, Queen Mary Hospital, and Prince of Wales Hospital, we has started the spinal SBRT and the spinal MDT service, and it was warmly supported by the surgeons, neurosurgeons, and also the radiologists. And with the initial data show that with MDT, actually it enabled us to have a better selection of cases for aggressive surgery and a better selection of patients for SBRT. Actually, the median survival of patients who had gone through the spinal MDT and also who received a major surgical procedure was improved compared with historical cohort. So we are happy that now we are getting 2 more centers, Queen Mary Hospital and Prince of Wales Hospital, to initiate the SBRT spinal MDT program. So we very much follow the experience and recommendation by the MSK group. And we also try to incorporate the spinal instability concept. So I'm not going to go through our SBRT and spine med pathway. So we understand this is a very heterogeneous group, so that's why we try to incorporate spinal surgery, decompression surgery, separation surgery in a relatively complicated pathway. So I understand it's not easy to incorporate this in daily practice, so that's why we need MDT. Actually, our MDT meeting, we have one MDT every 2 weeks, and we also have a very active WhatsApp group discussing the cases. So it's quite tiring, but I think it's also encouraging that we learn from each other. We learn from surgeon, and surgeon also now would tend to consult us on to provide survival estimate before they go in for a major surgery. And also they actively refer cases for us for SBRT. So that's a very good experience, and thanks Toronto's group for the experience sharing with us. So very quickly to summarize this, of course, in Hong Kong we have some strength for to develop SBLT because government they give a highly subsidized high quality service, radiation oncology service in all HA centers, and our electronic medical record system is mature. I would say we also have highly efficient and high quality service in private as well. And we have active clinical researchers in various centers and university, and a team of very enthusiastic clinicians. But of course, we also have a bottleneck. I think machine shortage is one big problem. So it was compared with reference to IAEA and RCR recommendation. And we think I believe we can do better if we have more machine and manpower. So we look forward to more investment by the government. And we also have a bottleneck in research and basic science. We have a lack of translational studies or facilities for SBLT or radiobiology research. And we have a lack of basic science researchers in radiation biology in Hong Kong. And so far, disappointingly, we still don't have an academic post for medical physicists. And Tony actually went to Seattle. So that's really sad. Actually, I think there's a lot of distinguished medical physicists outside Hong Kong. They're from Hong Kong. So look forward to funding for this. We desperately need dedicated medical physicists like Tony. And on administrative aspect, I think there's some issues on how we allocate and how we assess the performance of our public hospital. So it's still largely based on the number of fraction, the machine utility, and not on the complexity of treatment. So actually this is, SBLT, because we give a better treatment in less number of fraction. That's why it actually was disadvantaged in the current public performance assessment system. And I'll also say that actually the service provided by 6 RT centers in Hong Kong are very heterogeneous. I think this very much depends on the availability of subspecialists. And we have a huge manpower shortage and exodus of radiation oncologists in public sector recent years. So that's why that's a huge brain drain in public system. That's a major challenge we are facing now. So in view of this, we started a Hong Kong SBLT study group. So it's a territory-wide platform, collaborative platform to develop SBLT, to enhance the development of SBLT in Hong Kong. So we are happy that we have the support from clinical oncologists, medical physicists, dosimetrists, radiographer, and also other healthcare professionals who had interest in SBLT. So the objective is to promote education, knowledge exchange, improve the standard of SBLT, and to facilitate researchers in SBLT. So we try to promote professional education, public education, to be an advocate in policy change and research platform. So we just have our first workshop on planning dosimetry. The first workshop actually was an LIFA SBLT workshop, which was delivered in June 2018. We have local expert as well as expert from Singapore to have a very good interactive discussion in the morning. So we look forward to a second workshop early next year on central lung SBLT. So we also understand it's important to engage with other specialties. I think we need to do publication on local treatment results, and also we need to engage other specialties in our daily clinical work. So SBLT actually faces, we have to interact with thoracic surgeon, HPV surgeon, urologist, orthopedic surgeon, neurosurgeon. Actually, they are quite fond of SBLT from my understanding, and many of them would like to know more and collaborate with us. Besides, we are trying to write something on local newspaper. That's not an easy job because we got 3-4 doctors writing more than 2 years. So that's quite a heavy work. But we try to educate public about the availability of SBLT as an option. So I'm happy that at least in clinic, I saw some patients actively asking for SBLT. So I think this is a good sign, and hopefully with more public understanding in this area, we will get more public funding as well. and their support for SBLT. So as an advocate, we try to actually we like to fight for more resources and investment in SBLT. That means an investment in our in health of Hong Kong people, and hope that we can have a policy change, and which was based on CA studies. We are doing some on SRS, and we try to work out more data on SBLT. And I truly believe this is a very cost-effective study if we have more long-term robust data. And we try to modernize we should fight for the modernization of performance indicator and the policy change on the how to finance our healthcare system, and to overcome some administrative barrier for investigator-initiated studies at public center, or to overcome all the insurance and other indemnities issue. So as a research platform, we are still young and small, but we try to start something simple. We are working on a survey on SBLT practice in Hong Kong, and at least to have some retrospective review on SBLT outcomes at various body sites. And we try to work for a referral guideline to study the cost effectiveness, and hopefully to start a territory-wide SBLT registries. So to aim high, we are fighting for resource funding for immunotherapy plus SBLT trials. We have some early success, and hopefully we can update you our progress in coming 1 to 2 years. And some medical physicists suggest us to do a benchmark study on dosimetry, because I think how to make a good plan is still very much specialist dependent. So I think having a benchmark study will help to improve the overall standard. And in year 2019, Hong Kong will also have a MRI-guided MRI-guided LINAC. So we are looking forward for this. Hopefully can boost our research potential. And hopefully in year 2019, we will also have, probably in the coming 1 to 2 years, we will have our first animal machine for SBLT. So hopefully this can boost our mechanistic study on radiobiology. So this is the list of the very enthusiastic radiation oncologists in Hong Kong. And thanks for the support of all the bosses of our cancer, of our COS, Chief of Service of all public cancer center to support this initiative. We hope that in coming 1 to 2 years we can report you some more encouraging data and our progress. So in summary, so SBLT services are available in all public and private centers in Hong Kong, but the service standard and coverage is still quite heterogeneous. And collaborative effort is needed to overcome the bottleneck of development. And Hong Kong SBLT Study Group is a new territory-wide platform for education, advocacy, and research. Thank you for your attention.